Namaste, everybody, and welcome to today's program. Today's conversations with Dr. Marc Halpern. I'm Dr. Marc Halpern, and I'm honored to be sharing time with you today. As always, during the conversations with Dr. Marc Halpern, I'll be taking your questions today. And the questions make up the bulk of what we'll be doing during this program. Before we begin, though, I always begin with a few minutes of discussion about a topic of interest. And, well, this program is being recorded at the same time as the Delta variant is rearing its head and causing so many challenges for communities throughout the country and posing a lot of challenges for individuals who are on both sides of the political spectrum. And this particular political spectrum is whether or not to get vaccinated or not get vaccinated. If you're masked, if you're vaccinated, whether or not to wear a mask or not wear a mask. And rather than delve into the depths of that discussion, I want to take just a moment to talk about the importance of respecting everybody's choice. We live in a society where we do have that right to make a choice when it comes to our health and our well-being, and the right to make a choice when it comes to whether or not to participate in taking medical procedures, whether or not to participate in taking drugs into our bodies. That right is very important, because if we give up that right, then the government can force us to take any drug at any time or any medical procedure at any time. I'm not a big fan of that. I actually support choice, and I support those who receive vaccinations and those who do not receive vaccinations. It really is a personal choice, and it's that choice that is so very, very important. Naturally, some questions come in around this subject, and Gil, thanks for joining us today. You asked, well, what does Ayurveda say about the Pfizer vaccine? Well, Ayurveda doesn't say anything about the Pfizer vaccine, in the sense that Ayurveda is 5,000 years old, and we're applying those principles to modern day. If we were to apply the principle to modern day, there is a principle in Ayurveda that everything that exists in nature is a medicine if you know how to use it, and if you use it properly. And I would say that's true about all of the vaccines as well. For the right person, they are a good medicine. And for the wrong person, this is what Ayurveda teaches, for the wrong person, they can be a toxin. And so that's really the issue, is how it is used, for whom it is used. It's an issue of risk versus benefit for each person. That depends upon their age, it depends upon their health, and it depends upon their lifestyle, how many people they're around in everyday living. And so Alicia follows that up with the question, well, what did I do? Did I get a vaccination? And the answer is yes, I did get a vaccination. I made that choice because I felt that for me, the benefits outweighed the risks. For me, for my Dharma, requires me to be around a lot of students, a lot of patients, and a lot of the public because of the work that I do in this world. I came to the conclusion that if I continued just with everyday life, I would, and I wasn't vaccinated, I would get COVID-19, and I would probably spread it to lots of people because I'm around lots of people, whether or not I get symptoms or not. And I decided that for me, in my Dharma, in my work in this world, that the consequences of being vaccinated were not as high as the consequences for being unvaccinated, for myself and also for my community. I don't think that the decision I made is necessarily right for everybody, and I think that's really difficult for some people to understand. That's why I respect choice, because it's so important that we have the freedom to make that choice based upon our health and our well-being, and also the work that we do in the world. And so good arguments can be made on both sides. The science, the evidence shows that it is safe, within a short period of time. In other words, the short-term consequences are very safe. Nobody knows the long-term consequences because long-term hasn't happened yet. We can't know the long-term. Science can't study something that hasn't happened, but science can take a look at the likelihood of long-term ramifications and also the likelihood of short-term ramifications. And so far now, the vaccination has been available for about 7 or 8 months, and the number of serious short-term side effects have been very, very, very minimal, and to be what is expected from taking any drug on a mass level. So I feel comfortable taking it. Of course, I don't know what the long-term ramifications are, and of course, I don't know what the long-term ramifications of having COVID will be either. So there are arguments to be made on both sides. I don't want to settle those arguments today or even attempt to, because information is constantly changing and constantly being gathered, and that is the situation. But for me, in my life, with the work that I do in the world, the number of people that I'm around, it made the best sense to be able to do that. And people want to know which vaccine I received. I see that question there as well. I received the Pfizer vaccine, which is the mRNA vaccine, and I didn't have any effects, any side effects of taking the vaccine other than a sore arm and a little bit of fatigue. But other than that, I didn't. Which vaccine is best for a kapha pitta? There's no way to know that. There's just not. There's no way to know, what's going to be good for vata pitta kapha. We could say that those with low ojas and those with high vata have the highest risk of a sensitivity, because people with high vata have the highest amount of sensitivity. People with more kapha generally tend to have a lower level of sensitivity. This is to all substances, all sensory stimuli, and all substances, drugs, and so forth. This is for kapha prakriti. Now, if you have a kapha vikriti, that's more complicated. Any vikriti, the more serious the vikriti is, the more likely it is to lead to greater sensitivity, greater complications. In Western world, that's called comorbidities, because as you have high vata, high pitta, high kapha, you have more challenges in your body, more challenges in your mind, and therefore you're more sensitive to complications to anything that you do. But if you're generally balanced to begin with, when you go into receiving any kind of a therapy or any kind of a drug or any kind of an herb, you're less likely to have a negative consequence. And I think that may be one of the important lessons here, is the importance of keeping yourself balanced and healthy no matter which choice you make. If you make the choice to be vaccinated, you want to make sure that you go into that vaccination as healthy as possible, as balanced as possible, living a healthy lifestyle. And if you do not get vaccinated, it's essential that you maintain a healthy, balanced lifestyle, keep your immune system strong, so that if you do get COVID infection, you are less likely to have a dramatic consequence as a result of the infection. So whichever side you're on this discussion, everybody's on the side of building your immune system. Everybody's on the side of keeping yourself as balanced and as healthy as possible in your life. Okay, so I think that's important to know. Elisa says she felt the same, but got very sick. And so thank you, Alicia, for mentioning that. There are many people in the Ayurvedic world, in the yogic world, that are living healthy lifestyles that do get COVID and do get very sick. So that absolutely does happen. We have seen, I'm around a lot of people. So therefore, I'm also around a lot of cases. And I am around a lot of people that got vaccinated, and a lot of people that did not get vaccinated. And certainly the ones that did not get vaccinated, the ones that get sick. The ones that got vaccinated, yes, there are some people I've been around that got sick too, but it's generally been milder, except for the rare occasion where there's been an individual or two that had very serious comorbidities, that were quite a bit older and had more challenges. And so I think it's important to keep this all in perspective as well. There's a lot of fear, there's a lot of anxiety that's out there, and there is a lot of drama that is out there. The media certainly is promoting a lot of drama, because the media thrives in an environment of fear. And so if you're listening to a particular pundit on TV and they want to improve their audience, they will say something very, very dramatic. And it's important to keep everything in perspective. The risk is real of getting infected of COVID-19. That is true of the Delta variant. That is true. The numbers are rapidly rising. That is true. Hospitalizations are rising, but at a slower level. That is true. And the number of deaths are only creeping up, although they are more likely to rise as well, although at a lower level. And so it's important to know that 70% of the people in the United States, over 160 million people now, are vaccinated. And that means that this is not going to get out of control, and we're not going to go back into the same tremendous situation that we had last year. Okay, it's not going to be that way. Now, if you've been vaccinated, your anxiety level should be very, very low. If you haven't been vaccinated, then you have to take caution. You have to take care of yourself. That's the situation that we live in today. That's part of the choices we have also. And so if we make that choice to not be vaccinated, keep your immune system strong, wear a mask, especially if you're around other people or a large number of other people. The more often you wear a mask, it does help. It's not perfect, but it does help. And socially distance, but most importantly, keep yourself as healthy as possible. Alicia then points out, after the vaccine, I got asthma. You know, that's a really interesting comment, Alicia. You may indeed have had a reaction to the vaccine. There are statistically a small number of individuals that do have reactions to the vaccine. And that's true of any vaccine. It's true of the COVID vaccine. It's also true of the childhood vaccines that so many people get. And people do get negative reactions to them. I'm not talking about dramatic illnesses that kill lots of people. I don't want to have that conversation right now about vaccines in general, but I simply want to say that there are statistically a number of people that will always have reactions to any kind of a drug, any kind of a vaccine, even an herb, although it tends to be much, much lower with herbal medicines than it is even with the drugs. Now, sometimes when you vaccinate 160 million people, or now maybe 180 million people, you're going to have people who just also statistically happen to have a health condition that arises in the time frame following a vaccine that has nothing to do with the vaccine. This is the challenge with anecdotal evidence. You say, well, I had the vaccine, then I got asthma. I had the vaccine, then I got arthritis. I had the vaccine, then I had blood pressure irregularities. And so there's a tendency to blame anything that happens following getting the vaccine on the vaccine. But the chances of that happening again to a percentage of the population is also very high. So I try to keep it in perspective. This doesn't deny that there are challenges that occur with the vaccine. With any vaccine that's going to go into the body. It just means that we shouldn't jump to conclusions that anything that happens to us is the result of the vaccine, even if it is the result of our health. Somebody could get a diagnosis of cancer even within a month following the vaccine and might be thinking, oh, well, did that happen because of the vaccine? Somebody could have a heart attack. Did that happen because of the vaccine? But people are going to have heart attacks, and people are going to have cancer, and people are going to have asthma and other kinds of conditions. And so I think that's very important to keep in proper perspective. What may I do to regain my health? Live according to the principles of Ayurveda. This is first and foremost, right? This is the most fundamental principle. Live according to the principles of Ayurveda. Pacify the dosha that is vitiated in your body. If you don't know what dosha is disturbed in your body, you need to see an Ayurvedic doctor, an Ayurvedic healthcare provider, so that you can get the guidance that you need, taking herbs and taking the appropriate, following the appropriate diet, living the appropriate lifestyle. This is going to do the most for your body so that you can maximize your potential for healing, no matter what condition that you have. And then there will be herbal medicines as well that you can take that will help to facilitate that. Sue says, I haven't taken any medications of any kind for 20 years. I've also been very mindful of purifying my body of toxins accumulated. Should I vax? Gosh, I hear that a lot. And I really feel for you because I understand how difficult this situation is as well. We those of us that are living healthy lifestyles, these are big choices. I mean, I don't put GMOs in my body, and I only eat organic food, and of course I eat according to the principles of Ayurveda, and I'm so careful in so many things I do. And yet I also had to face that decision. Well, am I going to take the vaccine or am I not going to take the vaccine? The vaccine is not something that is natural, right? It's a man-made product that I took into my body, but I chose to do it because I felt that the risk of the vaccine in my case was lower than the risk of getting COVID-19. And so that choice was made by me, but it's not the right choice for everybody. And so this, I think, is an important lesson. So should you get vaxxed, Sue? I can't tell you that you should get vaxxed or you shouldn't get vaxxed. Everybody should look at the benefits for them according to their age, according to their health, according to their health history, current health and past health, and your age. And those are really big factors that go into how you're likely to respond to getting sick. They're not the only factors, but they are important factors. And then also your work in the world. Are you working around other people or are you not working around other people? Do you find yourself in large groups of people? If you find yourself in large groups of people, then I think it is probably very important to consider that, because if you're not vaccinated and you're in a large group of people, yeah, you're probably going to get COVID-19. So now you have to decide, which one would I rather have, the vaccine or COVID-19? And that's not an easy decision, especially when you've been as conscious as you have been, Sue. So I appreciate the dilemma that you're in. My focus is to educate people on the choices, and then they can make the choice that they want. I truly honor everybody's choice. I think it's a personal decision, and it's one that I would not want to see taken away from anybody. Okay. Now, I've gotten a couple of other questions. Let me just take a quick look through them. Do I believe zinc and vitamin C will protect you? Yeah, I do. I do, actually. I think zinc and vitamin C are very important. All the studies and all the research, especially on zinc, shows that it helps the body. They haven't done studies on zinc and COVID, but they've done studies on zinc and just about every other viral infection, and particularly the flu and the cold. And it seems to be very beneficial. 50 milligrams of zinc, preferably in the form of zinc picolinate, is one of the best things that you can do in order to fight off the virus. Vitamin C is a little bit more controversial, but has no negative side effects, nor does a appropriate amount of zinc. You shouldn't take it for more than 10 days if you're taking 50 milligrams of it. But as long as you do that, yeah, I think anything you can do that's going to help you, why not do that? I think that these nutraceuticals are beneficial. They're not Ayurvedic, but I think that they are beneficial. The next question that I got is anything for Vata Kapha to build their immune support? Well, first of all, I want to let you know that I did a video on Vata Kapha combination and how to manage it. And I think that if you look for that video on YouTube, that'll give you the most information. When we talk about Vata Kapha, we're generally meaning, most people mean, that in their imbalance, Vata has pushed Kapha out of balance. And when that happens, as an example, a person might eat because of anxiety and then gain weight. The gaining weight is a Kapha imbalance, but they're gaining weight because of the anxiety that they have. And so then we say Vata has pushed Kapha out of balance, and we have to manage Vata first and foremost, because managing Vata is always the most important. Anytime that Vata combines with another dosha, Vata can push Kapha, Vata can push Pitta, and so this becomes important to control. It may seem like we have a Kapha imbalance, and that should be our priority, right? Losing weight. The problem is when we focus on the Kapha, we aggravate the Vata. When we lose weight, Vata increases. When we lose weight, we increase the quality of lightness and subtleness in the body. These qualities increase Vata dosha. Then anxiety increases even more, so a person eats even more and gains even more weight. So it really doesn't work well to focus on Kapha when you have a Vata Kapha imbalance. So that's very important. The other approach is to look at the qualities that they have in common. And Vata and Kapha don't have many qualities in common, but they do have the quality of coldness in common. And so taking in warm spices and warm substances in general are very beneficial for both of these doshas. But of the two, you got to take care of Vata first. All right. Lori says, my 9-year-old granddaughter is in the ER with COVID. Oh, I'm so sorry to hear that, Lori. Yeah, we're just seeing so much of that today. And it's true that it's true in terms of their reports. They're still studying it because it's so new. But it appears to be true that COVID is affecting a younger group of patients. And that does appear to be true. And affecting a younger group of patients means that we're going to see not only more illness, but more serious illness in those who are not vaccinated. And that can include visits to the ER. Fortunately, the death rate is not as high as we might fear. And most of the people going to the ER are coming out of the ER. And when I say most, I mean the vast majority of them. So I don't want you to worry too much in terms of the overall outcome. When you're in a hospital, and in the ER, all you can do is follow the guidelines and the directions of the people in the hospital and the people in the ER. It's hard to bring in outside medicines and even outside dietary considerations, but you can sometimes in the hospital, not in the ER. And so you might be able to bring in healthier foods than you typically get it at a hospital, because at a hospital, it is more common to just be getting the generic hospital food, and it's not the best food. It's not really focused on supporting the optimum function of your immune system. So if you get to the point where there are visitations that are possible, then bringing in some fresh juices, for instance, fresh squeezed juices can be very beneficial for improving the health of the body. Good organic food. If you don't have an Ayurvedic diagnosis, it's hard to make Ayurvedic food for a person. Remember that in Ayurveda, the ideal is to know your constitution, know the nature of the imbalance, and then the food and the medicines are designed specifically for that person. And that's what makes it Ayurveda. Short of that, just eating healthy, organic, whole food is always better than eating the generic food you're going to get at the hospital. So if you can get some of that to a patient, that would be great. Now, once your granddaughter gets out of the hospital, then really getting her evaluated by an Ayurvedic doctor would be essential. If you're looking to get evaluated by an Ayurvedic doctor and you don't have one in your community, our clinic can support you through video consultations. That wouldn't be with me, but it would be with one of the Ayurvedic doctors that are on the staff here at the college, and they can consult with you or your granddaughter or anyone else in order to help you to understand your constitution, the nature of the imbalance, and then the diet, herbs, and lifestyle that will most support you. When possible, in-person visits are the preferred basis because we can take the pulse, we can see more clearly the tongue, and so we get a little bit more information. However, the remarkable ability of technology today to support healthcare is extraordinary. So we can provide that as well for any of you that are looking for that kind of support. You're welcome, Lori. You're welcome. Next question that comes in: how can Ayurveda help autoimmune diseases? Pooja, I understand that many people today are having autoimmune diseases. It's an extraordinary problem. This is really the end result of low ojas in the body. That's what creates autoimmune diseases and makes them worse. Ojas is that which stabilizes the body and stabilizes the mind. It is the product of healthy digestion of foods that have high ojas building potential. Foods that have high ojas building potential are foods like nuts and oils and whole grains. These are good examples: milk, butter, ghee, and so forth. These same foods that can build ojas are the same foods, unfortunately, that also produce ama, which is toxicity in the body if you do not digest them properly. So it's essential for them to be digested properly. And so that's where Ayurvedic cooking comes in and Ayurvedic food preparation comes in. It's done to assure proper digestion. It means that the proper spices are added to these heavier foods that are sometimes hard to digest to make sure that we're able to extract the ojas from the food. So I think that's really important. For autoimmune disease, the most important thing, as I mentioned, is building ojas. Typically, in most autoimmune diseases, these are imbalances of vata and or kapha. Vata and or pitta dosha. Pitta creates the inflammation that's sometimes associated with it. Vata tends to weaken the system, and they tend to combine together. For those of you that don't know, autoimmune diseases include the entire family of rheumatic joint diseases, as well as conditions like thyroid diseases and so many other diseases. That there are some digestive diseases as well that are also due to autoimmune disease, things like ulcerative colitis and Crohn's disease. Some autoimmune diseases are triggered by genetic tendencies as well. And so this is a challenge for people. It's hard to heal the genetic component of it. This is where the highest level of healing takes place. The highest level of healing, according to Ayurveda, is to go beyond even focus on foods, beyond even focus on herbs, beyond even focus on lifestyle, but to go even deeper than that and to focus on our connectedness with the divine. When we connect to the divine, we experience more peace of mind because we see the divinity in everyone and in everything. And when we see the divinity in everyone and everything, our hearts open and we feel more love to the world. We feel more love to everyone in the world, especially those people that are not like us. Whether they're not like us because they're making different choices, like to get vaccinated or not to get vaccinated, or they're not like us because they have a different skin color, or they're not like us because they have a different national origin. When we feel connected to the divine, Ayurveda says our hearts are going to open and we're going to feel that connectedness with all of creation. The fruit of that is peace of mind. And when we have peace of mind, then our bodies function better as well. Now, it's our karma that tends to disturb our peace of mind and interfere with our ability to feel the connection that we have to everyone and to everything. And so indeed, as we do our spiritual work in the world, which in Ayurveda and yoga is called sadhana, when we do our spiritual sadhana in the world, then our hearts open, our connectedness increases, peace of mind increases, health and well-being increases, and we're even healing the karma that is contributing to the conditions that we suffer from. So that kind of deeper self-reflective spiritual work, psycho-spiritual work, is an important part of healing any genetic condition. And that includes, to some degree, autoimmune diseases. And I would go as far as to say that that could really be incorporated into the healing of every disease and every condition that we have. If you really want to be protected from COVID and everything else in the world, learn to love and learn to allow love in. Love really is the expression of ojas. When our ojas is healthy, it is the expression of sattva, when we feel that clarity that connects us to the divine. We're starting to run out of time, and I know you have so many questions, and I have pages of questions in front of me, and I won't even be able to read them all, let alone answer them all, but I'll stay on just a couple of extra minutes to answer some questions. Nitu says, I'm trying to lose weight and get rid of inflammation in the body. What Ayurvedic practices should I do? Well, weight gain is due to kapha imbalance, and inflammation is due to pitta imbalance. Now the question is, why do you have inflammation? Why did you gain weight? Of course, we can say the obvious, right? If the obvious is if you've gained weight, then if you eat lighter foods and you eat less, then you should lose weight. And so if we're dealing with just a pure kapha imbalance, then indeed, that would be the path that we would take. We would be eating lighter foods and smaller quantities of foods in order to help us to lose weight. And pitta is responsible for inflammation. Pitta is heat. And so we would go ahead and want to avoid those things that tend to overheat the body, whether it's too much time in the sun or whether it's hot, spicy foods. And we want to be taking herbs that are going to cool down the body, and particularly the liver, which plays an important role in inflammation in the body. Ayurveda would call that Ranjaka Pitta, which is the pitta that lives inside your liver. And so that's the obvious if you were just treating pitta or treating kapha. But so much of this, as I mentioned before, it can be driven by vata, which really complicates it, because if you have a vata imbalance and you're also not sleeping well, if you have a vata imbalance and you're also constipated, if you have a vata imbalance and you have challenges with anxiety and worry, well, now you have a tridoshic imbalance, or what's called a sanipatika imbalance in Ayurveda. All three doshas are out of balance. You really need to work with an Ayurvedic practitioner for close care. There are strategies to follow, and they are successful when they are followed. So you absolutely can lose weight. You absolutely can reduce inflammation if you do the things that are going to lead to that end result. It's a lot to go into in the last couple of minutes of this program today, but I would encourage you to have a consultation and work closely with the practitioner who is skilled in guiding you. I think that that is important. Gosh, I want to keep on answering all these questions. We will do these Q&As from time to time. There are also past Q&As that you can watch on YouTube as well. And you can also ask questions or maybe join our Facebook group. You can join our Facebook group. It's called Ayurveda, Yoga Nidra, and Yoga Therapy with Dr. Marc Halpern. There are now about 10,000 individuals that are in that group participating in discussions. I post in there every week, sometimes twice a week, and I answer some questions, sometimes even 3 times a week. So come and join us in the group. That's Ayurveda, Yoga Nidra, and Ayurvedic Yoga Therapy with Dr. Marc Halpern. That might be a good way for you to continue to learn more. Of course, you can also learn more by keeping in touch with the California College of Ayurveda, taking a look online at ayurvedacollege.com at all of our programs and all of our offerings. We have workshops and seminars for the general public. We have workshops and seminars in body therapies and in yoga. And of course, we have complete Ayurvedic training that can lead you all the way to becoming an Ayurvedic doctor. You can study at home. You can study through independent study, working with a mentor, or you can be live over the internet. And of course, you can be in the classroom because we are a physical institution. We have a beautiful campus here in Nevada City, California. We have meditation gardens. We have herbal gardens that you can explore. We have multiple classrooms. We have an outdoor amphitheater. Come and join us sometime and take a look around and enjoy the college. It's truly a joy to spend this sacred time with all of you. And I want to follow up on a thought I shared with you just a moment ago as we end today. And that is the importance of learning to love. Right now, we are in such conflict in this country. We are in such conflict throughout the world. Yes, we're being affected by COVID, but that is not actually the greatest challenge that we face. The greatest challenge that we face is our own divisions with everyone else in this world. All those individuals that we are in conflict with. Trying to heal those divisions, heal our hearts, heal our immune systems, and ultimately will even heal the planet. We must come back together as a people, as a community. And as we do that, that is going to bring about a level of healing that is far greater than any herb that you can take, far greater than any food that you can eat. And so I want to leave you with that hope, that prayer, that for you and the people in your lives, that you're able to reconcile and come back together, most importantly, with anyone with whom you have division and separation. Open your heart. Perhaps they'll open theirs. We can't control the hearts of others. We can only control our own hearts. And when we open our hearts, we heal on the level of body, mind, and consciousness. Many blessings to you on your continued healing journey. Namaste.